If you hear the term, oh, this is a good doctor, what do you think the public expects on who a good doctor is?
We want empathy, concern, clarity. They should be able to explain. We want them to be forward and at the same time tender.
And these expectations, they are justifiable, absolutely. We as doctors are trained to work well under pressure, to be disciplined, to follow protocols, guidelines. It's part of our training and we should be able to deliver on that. But in the same breath, we are also human.
We expect doctors to be perfect. We expect doctors to never miss a step, to always be on time, on point. We expect doctors to never be tired. We expect them to essentially not be human. But even in the most advanced societies, healthcare is still delivered by human beings, not robots, by human beings to human beings. Today, we're going to be talking about some of the gaps in the expectations of healthcare system and the reality as we know it, and how bridging this gap can greatly improve our healthcare outcomes. Welcome to the Care Conversation podcast, an honest space designed by the Patient Doctor Forum Nigeria, where we have honest conversation about healthcare issues, especially those conversations that you don't see often. I'm your host, Dr. Emmanuel Sani.
And I'm Dr. Temitope Oyetunji.
And today we have with us a special guest, Nkoyo Ita Epeon, an educator and healthcare user who represents the public and patient perspective on this matter. It's very lovely to have you here today.
Hi, everyone. Thank you for having me here.
Oh, it's a pleasure. And thank you so much.
Glad to have you.
Thank you for honoring our invitation.
It's my pleasure.
Oh, that's wonderful. But before we get started, a few quick notes that we'd like to just highlight. This is not a platform where we support negligence. It's about having honest conversations about issues with varying paradigms and perspective. It is not about pushing for low quality, but it's about understanding how our current situations in reality and how we can improve the outcome. Accountability matters, but so does context. Now, if I may start with you, Ma. So, if you hear the term, oh, this is a good doctor, what do you think the public expects on who a good doctor is?
Okay, first off, I think what the public expects, we want empathy, some form of empathy. We understand doctors are very busy because they get to see, depending on what they do, a large number of patients daily. But as humans, we equally expect some form of warmth and empathy from them. Right. Some form of concern, clarity when talking to us. They should be able to explain whatever the situation is with the patients. We want them to be forward and at the same time tender. We expect too much. Yes, we expect too much, and we should also give them that same grace.
Yeah. You know, it's always exciting seeing the other side of the perspective of how, the patients and then the doctor. So it is refreshing. But Dr. Temitope, where do you think these expectations come from? And what do you think the average, patient doesn't see when you talk about this?
The expectations come from the way we were brought up. In any average Nigerian home, you see medicine as a calling. They say doctors save lives, it's a noble profession, and all that. That's the narrative we grew up with. So we hold doctors in high esteem. We expect competence from them. But beyond that, we expect character. We expect discipline. Discipline as if there's even no room for weakness.
Right.
That's what we expect from doctors. And these expectations, they are justifiable. They are justifiable, absolutely. We as doctors are trained to work well under pressure, to be disciplined, to follow protocols, guidelines. It's part of our training, and we should be able to deliver on that. But in the same breath, we are also human. Most times we are able to, stick to these protocols, to the guidelines and everything, and things work well most of the time. But some of the time, humanity creeps in. System failures creeps in. It could be in form of fatigue. The doctor has been on his or her feet all day. It could be in form of system failure, no oxygen, lack of bed space. It could be in form of even decision fatigue. By the time you're seeing the 40th patient, your brain is still supposed to be sharp as a first,
if it's the first.
or is expected to be sharp as a first, but
Yeah.
that's not realistically
Yeah.
possible. And sometimes it's the minor concessions that we even do for example, maybe VIP patients or people that will feel pressured to please. Those minor concessions also sometimes can affect outcomes. And these are all the imperfections in the systems that affect outcomes. This is not excusing suboptimal care, but it just explains why there's a gap between what is expected and what we actually experience.
Wow. I would say this, even as a practicing physician, being a doctor is one of the highly pedestalized professions, I would say, in society. Like, let me give it just on a lighthearted note. If you go into a plane now and a pilot is going through the manuals, they say, okay, he's trying to be thorough. Or a lawyer goes and checks, the Constitution when he's reviewing a case. They say, okay, that's expected. But if you see a doctor checking his phone or browsing, you're like, these doctors, how do you call it? ChatGPT doctors these days. It's like, okay. Because they kind of like expect doctors to be a certain way because life is in their hands. So I would ask, Koyo, like, hearing what she has said, what do you think? Or does that influence how doctors should be perceived in any way? Or any less than robots, for instance? What do you think? What's your opinion?
Okay, I think we should still, as patients or as public users, we should show some form of empathy to the doctors because they are humans. And like Dr. Temitope rightly said, by the time you get to see your 40th patient, fatigue sets in. We are all humans because in our various spheres of endeavors, we equally have fatigue too when we are under pressure and all that. But how do we manage them? In as much as we show them some form of empathy, we expect that we should have some form of clarity, transparency, that accountability too should be there. Like she said, she mentioned character. We are all different and we don't expect everybody to behave the same way. However, we expect some form of just be nice to us and we would equally be nice to you. But then you cannot control everybody out there.
Exactly.
You
Yes.
cannot.
Yes.
You cannot.
Yes.
So it's not a one size fits all.
Yes.
So we should, I think everybody should have that form of grace. You want some grace, you should be ready to show some grace.
Yes.
Right,
Yes.
right. And it's interesting that you touched on that. So I was going to ask you, then what do you think on the flip side now? What do you think is one thing that, doctors should understand about patients in those moments? Because they're not wrong for having these high expectations. It's life that we're talking about.
At that point, what comes to the patient's mind is, I want to be well. I want to be fine.
Right.
I want to know what is wrong with me. I want to know what the problem is. How do I tackle it? What do I do? There are so many things happening out there that not pleasant and pleasant. People have had the good, the bad, the ugly experiences with the health sector. But then how do we manage all of that? So we want them to, they should be professionals.
Right.
Professionals now is relative, but they should be professionals.
Right. And I agree. Essentially, from what I've gathered, it takes two to tango.
Yeah.
When from the patient parts, they come with understanding, the system that we're in and the expectations and responsibilities of a doctor. The doctor also should know, the magnitude of what they're doing and trying to, obviously deliver the best healthcare system.
Yeah.
Dr. Temitope, what do you think? How do we acknowledge the humanity of doctors without sacrificing accountability? Because people need to be held accountable.
Yeah.
We do understand that there are, situations of negligence. So how do we balance both?
That's a very good question. And we need to get it right.
Right.
We can use humanity as an excuse for harm. So if a doctor's actions lead to avoidable harm for the patient, we can say, oh, don't worry, you were tired, right?
You
So
sure
don't
understand.
worry. We could understand that.
God give it, God take it.
At that point in time, nobody wants to hear that.
Nobody understands that. And when we were swearing an oath, we didn't say, I promise to do no harm as long as I'm well rested, right? So we didn't do that. We chose this profession. It's a high stakes profession. And we
Right.
chose it. There is accountability and doctors should be held accountable. But the part we also need to understand is we should also show humanity. And the way we do that is by not rushing to judgment when cases happen and we don't know the full story. We should not rush to judgment, and we should ask questions beyond the actions of the doctor.
Right.
We should ask questions that has to do with the system. Like, what were the systems in place? Was this doctor overworked? Were there protocols that could have been followed that was not followed? Was this a failure of one person or a failure of a system, of a number of people? These are the bigger questions we need to ask when failures or bad outcomes happen in healthcare, and not just focus on the doctor or blame the doctor. I read a post by Dr. Fatima Damagun today about this particular issue, where she was talking about a case that happened in a government hospital. A woman had surgery, and then a forceps was forgotten inside her. As she put it, neatly tucked behind her uterus. I think that was the way she put it.
Yeah.
And later, they realized it after they did an x-ray. The patient had to be taken back to theater, and then they removed it. And afterwards, an inquiry was made into that incident. So many systemic issues were discovered, but the major thing that was done was that the lead doctor was suspended because heads must roll, right?
Yeah, must roll.
And once that has been done, everybody thinks the matter is settled, but that's not the case.
Yeah. And to those that don't understand what the case was, forceps is a metal instrument
Yeah.
that was forgotten inside someone. So
Yeah. For that kind of incident, it doesn't stop at just suspending the doctor, the
Right.
lead doctor. It goes beyond that,
Deeper.
to the systemic issues. Because if we don't deal with those issues, then we are not taking care of the problem,
Right.
the problem at the root. To answer your question, we can hold somebody responsible without vilifying them, without saying that they are negligent or wicked. We can still hold them accountable without, judging them, especially when we don't know the entire facts of the case. We can still hold them accountable, but we should not scapegoat doctors.
Yeah. Because at the end of the day, being a physician is a calling, in that it's someone's life, and people
Yes.
go into the profession with the desire to save, and it's not uncommon knowledge these days that we know that it's not because of wealth that you don't go into medicine because of being rich. There's no money there. Like, you might as well do tech or something.
Yeah.
The rigor of studying and becoming a physician, you might as well do a PhD. So it's
Yes.
more than that. But why these people should be held accountable, there's the understanding fact that they're there to try and fill that gap in saving lives.
Yeah.
It's great. So I would ask Dr. Temitope, how do you think the healthy people listening to this podcast right now, watching us, what do you think? Why do you think they should take this seriously?
They should take it seriously because illness does not write you an advance letter.
Right.
You don't wake up one morning
Bars.
and say, I'm going to land in the hospital today. Emergencies happen.
Right.
You never know when you need healthcare. That's why every Nigerian should be prepared. Because when you get sick or when you need healthcare, is not when you start learning about the system. Because at that point, you are in pain, you are under pressure, and that is not the time to start learning. Yeah. It's like living in Lagos and not knowing about Lagos traffic. Sure. Like, you don't know the shortcuts. Maybe you walk close to your house and you don't usually have to go through the problem areas. But you still need to know those shortcuts for the day you're going to encounter the traffic.
Absolutely.
It's just like that. We need to know how to navigate the healthcare system before we need it. And let me tell you one truth. You don't need to leave the shores of this country to get excellent care.
Yeah.
You can get the best care here. It may be expensive, it may be stressful, but you can get the best care if you know how to navigate healthcare in Nigeria. That's what patient empowerment is.
Right.
It's about knowing the questions to ask, how to ask. It's about knowing when to trust your medical team, when to seek a second opinion. It's not about fighting in hospitals or raising your voice, putting doctors in their place. You know, when you get to the hospital, like, I know what I'm doing here, I know my
Yeah.
because that can also affect your care negatively. That is not patient empowerment. It's about being informed
Yes.
about your healthcare needs and how to approach healthcare to get the best out of it. That's what patient empowerment is about.
Right.
And that's what we are here. We're here to create that awareness that healthcare is not something that is done to you. It's something you actively participate in.
Right.
Yeah, so let me chip it in. And
Okay,
I
great.
think going through her book, she wrote a book.
Right.
That's Dr. Temitope,
Right.
The Smart Patient. I'll recommend it for everyone to read because she talked a lot about the patient's rights, knowing your rights, because most of the time we don't know our rights and we don't even know what to expect from the system. If you get hold of her book, you would be enlightened.
Yeah.
I assure you it's one book that you would not want to miss.
Right.
So a lot of questions, most of this conversation, most of them, what we're talking about, you get to find them in her book, talking about the smart patient, who the smart patient is, rather.
Right. And that's perfect. And you see that, we already came back to Dr. Temitope's book. To those of you out there who are wondering what is this gold of a material, feel free to reach us on any of our platforms. The team will be willing to, tell you how you can get that. Okay, I'll ask this question. So I see now that you're well armed with the law of information. So if you go back in the past to one time, an encounter you had, is there anything that knowing now that you would do differently?
Yes, choosing to be a smart patient, I would ask questions. I would seek for clarity.
Right.
And then follow-up. Follow-up is very important, that I go back for follow-ups. If I'm scheduled to visit the hospital again, I would stick to that. And I would also probably take someone along for a different view, if it's possible, to tag
Right.
along with somebody to the hospital. And so I'll do all of that.
Yeah. I think one important thing that I totally resonate with what you said is asking questions.
Yes.
A consultation room is not an interrogation room.
That's right.
Doctors actually want you to ask questions.
Yeah, we do.
So at the end,
So sorry to cut you.
Yeah.
Sometimes the facial expressions,
I
they are not welcoming.
get it.
So
I
when
get
you
it.
see the doctor's facial expression, the next thing is, okay, let me just leave here.
Yes.
Yeah, but that shouldn't stop anyone, right?
We'll
If
try.
I would tell
We'll
anyone,
try.
it's true.
Mm-hmm.
That shouldn't stop anyone. The doctor has a right to make their face any way they like it, but you also
As your
have
health.
a right to get
To know.
information. So don't look at the doctors. Maybe that's how their face is. Don't worry. Just ask your questions.
Yeah. At the end of the day, that's why we do this. That's why we create awareness.
Yes.
For doctors also that, obviously watch and reflect on your communication skills.
Yes.
It's for
Very
us to know.
important.
And, in fact, whether it's your 40th patient or your first patient, we work hard to
Yes.
improve our communication where it's,
Yes.
it's subcortical to just
Yes.
say, I just put a smile like, how can I help you? And, so that the patient feel at home. And
Yes.
that's how doctors become family. in, a lot
Exactly.
of
So the
cases.
point to each side is doctors try to adjust your
Eh-heh.
face, let it be welcoming.
And patients ask.
yes, ask.
Don't say you still have
yes,
to. Please
Because
ask.
the facial expressions, they can put one off. When
get
you
it.
see, okay, for me personally, once I see it and okay, this person is not ready to respond, I'll just leave you and go.
I get
away.
it. I get it.
So not everyone would be willing to push further. But then, like I said, I would ask,
Yeah.
unless you kick me out of your
So everyone out
your
there,
consulting.
ask.
Exactly.
If you're not clear
I would
about
ask.
the dosage, ask.
Ask.
If you don't
Yes.
care about
Yes.
the diagnosis, please always ask your doctor, and I'm sure they'll answer you. This going to a different angle. Recently, I don't know if you're apprised of this, but I mean, pretty much everyone, we've been seeing the recent story with Chimamanda and the tragic loss of her son. It's an entirely unfortunate incident, and shook the entirety of the country, and that was just a few weeks after the Anthony Joshua and his friends incident. We have several conversations that have risen from this, but I would ask you, Koya, when you see some of this content online, what emotional reaction do you have at first?
Sad. And the slang we used to say, may Nigeria never happen to you. Because now according to the story, She went to one of the best hospitals in Lagos. So it is not about, it wasn't about the issue of money to say she couldn't get the best healthcare. And she had the funds to seek for that, but then something happened. So for me, when I heard the story, the first thing was, may I never be in that position. That's always what we pray, that may Nigeria never happen to you or your loved one or anyone you know. So it wasn't a pleasant one.
You know, I do know of the expression Nigerian, of course. May Nigeria never happen to you, something that we definitely say, and we do understand that there's a system issue here. But I think the bigger awareness that, you know, a conversation that should be had is some of these issues happen in spite of everyone, or at least thinking that they've done all that they could. And that's why the conversation never stops. It's something that we continually push to get there. Dr. Temitope, when we talk about the expectations on doctors in Nigeria, would you agree that there's been obviously a growing mistrust in doctors? Now, we have people that travel out. I mean, obviously, if they're financially capable to see other doctors in other healthcare systems, which ironically, sometimes they still meet Nigerian doctors. Why do you think this is? And what can the doctors do differently?
The mistrust is real. Sometimes it's justifiable because almost every Nigerian has those stories of misdiagnosis, stories of somebody who died because maybe there was no oxygen or doctors are on strike. We hear all these stories and they feed us, with that mistrust. It is justifiable in some cases. I've worked in a particular healthcare facility in the nation's capital that is has a reputation. I've heard not 2, not 3 people tell me that once you take your loved one or relative to that hospital, they die. That's not true. There are countless other good outcomes that have come out of the hospital, but the bad ones always seem to overshadow the good ones, right? I've had my own negative experience of healthcare too, but that doesn't mean I've given up on the system, because as long as I don't have intentions to jump on the jackpot train, I still have to assess care in Nigerian hospitals. If anything, it has taught me to be more vigilant, to be more attentive for myself, for my loved ones, right? So what we should not allow is all these stories and these experiences is to make us have that fear. Because if we have that fear, it could actually lead us into making the wrong decisions that can actually affect our care.
Right.
So we should not give room to fear. Instead, we should be more aware. We should be more involved in our care. We should participate in our care. Now, about the high-profile incidents like the one you just mentioned, it's sad, like you said, and we won't litigate it here because we don't know the particular
The full
circumstances surrounding that particular incident. But there are at least three things that those kind of incidents teach us. Number one, like you've said, is that bad outcomes can still happen in the best hospitals.
Yeah.
So even it may not be in Nigeria, even outside,
Anywhere.
bad outcomes can still happen even in the best of hospitals. Number two is that when protocols are in place, it reduces the risk of these bad outcomes. When you have checklists, escalation, pathways, you take consent all the time, you maintain your protocols regardless of who is involved. If it's a VIP or a VVVIP, you maintain your protocols. All of these things, they help to reduce the risk. The third thing is that even despite everything, human weakness, imperfect systems, which occurs all around the world, can still happen, and some of these errors can still slip through the cracks. Yes, so that can still happen.
Right.
And that is something, nobody prays for that. Like you said, nobody hopes for that. But the truth is, it is a fact. And when these kind of things happen, sometimes the last layer of protection for patients or loved ones is the relative that is around. They are the ones that are seeing what is going on. They are the ones that can ask questions, that can make changes, that may be able to salvage some of these bad outcomes, right? So that is something we can just learn from this incident.
No.
Bad outcomes can happen anywhere, but when we have protocols, it reduces the risk. And when this kind of things still happen, well, we just have to go back to the drawing board like we are doing now. I think this incident has caused, I think there was a panel or something that was constituted because of that. Well, that's like medicine after death, but it still goes to at least help to check the system deficiencies and prevent future occurrences. So, yeah.
Well, and I think you spoke some really important things. From the institutional perspective, there's a lot that can be done and should be done, and about just procedures that would not be bent regardless of how important the guest or patient is, and also redundancy of doing things over and over again. At least when we try to curb what can be preventable, we know that at least if we've done all our parts, then it'd be easy to be understood. It'd be easy to be understood if something else happens. But let's talk shared responsibility. Like we said earlier, it takes two to tango. And as much as the doctors and the healthcare facilities have a lot to do in doing their part, we also believe that, patients should. Chloe, do you think that is too much to ask, that in terms of patients needing to play their parts in these conversations?
No, it's not too much. But then patients, they need to be educated. If the patients are empowered, I think we would not expecting less now. We cannot expect less from the health sector because health is life.
Yeah.
But
Agreed.
we would know what we are into, and then that clarity will be there. Yes, for the social media now, after most times now, what people get to do is you prescribe a form of medication, they go back to check online to verify, should I take this? Or maybe they have a relative abroad or a friend abroad, and the next thing is they put a call through to the person. This was prescribed. What should I do? And you now have two people, two different
managing
opinions.
the patient.
We talked about trusting the system. So I think the education should be there.
Patient empowerment should obviously be a top priority. I think the more patients know, the more it will, generally help in bridging the gaps in communication.
Yes.
When you said a couple of things, I have vivid memory of certain things happening. I remember talking to a patient and saying, I think you need this drug. Patient vehemently told me, I don't think I need these drugs. And then went out and said, I'll call my sister abroad. And then came back and said, I would take those drugs. And I'm like, I was like, well, I'm glad that, your sister agrees, because it could be another thing now.
If it would have been terrible if the sister had a different opinion.
Yes, and they'll be like, please talk to my, and I'll start explaining what I think.
So,
well, definitely something that, we should highlight. And I guess that's why, the Patient Doctor Forum in Nigeria is trying to establish conversations like that. So, don't be greedy. If you see this, share it with someone else so that they can benefit from the conversations that we definitely have here today. So, but I'll ask you, Dr. Temitope, when we talk about the humanity of physicians or the systemic deficiencies that we have here, is it just Nigeria? Is it Africa, or is it everywhere? What do you think?
No, it's not just Nigeria. We are all humans all over the world. People in UK, Canada, they are not they are humans too.
They have the same blood.
Yes. So it's just the skin color that is different, right? So everybody, it's everywhere.
The mistakes happen everywhere. Same magnitude.
It happens everywhere. That's what you have over there. You have litigations because these things do happen over there too. So it's not only a Nigerian thing. Anywhere that there are a lot of people involved, if everybody does not play their part, there are going to be gaps. There are going to be errors. So it's not only a Nigerian thing. It's like citizenship.
Right.
In Nigeria, we have that habit. We don't do our part. We don't pay taxes. We don't do what we're supposed to do. And then we heap the blame on the government. Government this, government that. It's the same in healthcare. Everyone has a role. The patient, the doctors, other healthcare workers, policymakers, the hospitals themselves. We all have a role
to play.
Healthcare is a shared responsibility. And that's the awareness we are trying to bring to the fore. Let patients just not sit back and say, no, I don't have any part to play.
Right.
They also have a part to play.
Right. Yeah. Thank you so much. Wow. I don't even know if I want this conversation to start. Like, even being a physician and obviously seeing the back and forth with Nkoya and Dr. Demitope, I think it's really enlightening.
Yeah.
But we've
We have
come
to
to
go.
the end right now. So I want to ask you, Nkoya, any final thoughts?
Okay, patients, as as public users, we want to be respected. Now we've talked more about the doctors, but we know that we have other people to
Other healthcare workers.
other healthcare workers. So they should respect the patients. Now we know respect is reciprocal, but a lot of people have been disrespected, and most times you cannot, most especially if you get to use the government hospitals, you don't really have much to say, because it's either you listen to them or you would not be attended to. So, and patients too they want to feel safe. We want to feel safe. We want to be sure that if a doctor says you have a headache, yes, I have a headache, and I can trust you. I can take your word to the bank that I have a headache, and whatever medication has been prescribed, if I take it, I'll be better. So that form of feeling safe, patients, we want to feel safe, we want to be heard, and we want to be respected. I believe it's not too much
to us.
No.
to ask. I believe it's not
Certainly
too
not.
much.
Dr. Teresa, would you like to add a few things?
Yeah, it's definitely not too much to ask. And let me just say this in closing. Doctors are not robots. They are imperfect humans who work in imperfect systems. So yes, all doctors are accountable. But when you do that, also know that they are humans. And sometimes what appears as wickedness or negligence is just a failure of systems. And for patients and families, please don't wait till emergencies before you learn how to navigate the healthcare system, especially in Nigeria, because sometimes you may not have enough time to travel. Patient empowerment is not about fighting doctors or scapegoating them or making them out as the villain. It's about knowing when to ask the right questions, knowing when to trust the team, knowing when to seek second opinions. Because the safest patient is not the loudest patient, it's the prepared patient. So
Love it.
prepare your questions, prepare your money or your health insurance, and prepare your mindset. And most importantly, prepare to actively participate in your care. It's one of the things you can do for you and your loved ones to stay safe. And that is completely within your power to do. I see myself out.
I love it. I love it. Our dear viewers and listeners out there, we've come to the end of the podcast. If this podcast resonated with you, feel free to follow us on all platforms. Follow the Patient Doctor Forum Nigeria. There's a lot of good things coming up. And don't forget to share this. Like I said, don't be greedy. Share this with somebody. Let them see it. There's a lot to unravel and unpack here. A lot of conversations to be had. For doctors out there, it's an opportunity for you to reflect on your communication. Put a smile on that face and think of ways you can help better your patient healthcare. And for patients out there, there's an opportunity for you to know that you can be prepared even before you get to the doctor's office. So this is the end. But don't forget, better conversations lead to better healthcare. All right. So see you guys soon.
Bye.
Bye-bye. Hit that like button and see you again soon. Bye.
Bye.